Hi there, and welcome to another edition of Conversation Collage. We talk with interesting people, we talk about the things they're interested in, and we try and keep it somewhat friendly, and you might learn something by the time it's over. Quick edition for you today. I tender apologies for my voice. Seems like I've managed to get a bit of a head cold, although I really don't know from where. And that fits in pretty well because we're going to talk about the flu and flu season and the difference between colds and flus and what you can do about it in a new survey that deals with flu. So let's get right into it. By the way, Ken Johannesson here. I realize I didn't introduce myself. How are you? Nice to have you with us for this edition. According to estimates from the Centers for Disease Control and Prevention, as many as 45 million Americans can get the flu each year. It's common, but it can be serious because it can cause serious complications that can even result in somebody losing their life. And here we are with flu season upon us. There's a new survey out dealing with the flu and people's opinions about it. And there seems to be a lack of knowledge about being prepared for the flu. And we talked about the survey and the flu and what you can do about it. And we talked about it with Dr. Cedric Spock, who is a physician specializing in infectious disease. Dr. Spock, hello?
Good morning.
Hello. Where are you today, sir?
I am in Dallas.
Dallas, Texas. I take it that's home base for you?
Dallas is home base for me, yes, sir. But I did my fellowship in Seattle.
Oh, did you?
You guys are in Yakima.
Oh, Yakima. Well, we're in Wenatchee, which is just a little bit north of that. So
I know Wenatchee.
Yeah. Where the apple? Well, you're in Yakima. The apples come from both places. So
right. No, my oldest, he's now 19, but he learned how to ski over there, and and those are good times.
Okay, good. Well, glad you enjoyed it. So there we are. Nice to have you on board here. Here we are talking about the flu, and understand there's a flu survey that came out. Tell us about the Genentech flu survey. What was Genentech hoping to find out?
Sure. So this morning I'm teaming up with Genentech to kind of get the word out, and one of the ways that they initiated getting the word out was to ask the question, like, all right, let's look at flu awareness and kind of evaluate flu awareness across the country and ask about 2,000 respondents questions about the flu and how it affects them, or do they think about it, etc. And the conclusions that came from that I think was most important was that 1 in 4 of those surveyed didn't think the flu is serious.
That's interesting. So they don't think it's a big deal. Why do you think they don't think that? Why do you think they think that way? There's a question for you.
Yeah, no kidding. No, well, in the realm of infectious diseases, the infectious disease, regardless of what it is, wants the host that it's going to infect to not think it's serious. So, in a way, this is an example of influenza winning. Like, if we don't think it's serious, then the influenza is going to win, because flu is serious and, without sounding alarmist, can sometimes have complications with further issues. And so we need to remind ourselves that every year flu is serious. We got to remember.
And I'm looking at some of the results here. 1/4 of adults would not know what to do if they got the flu. That's kind of scary too.
Right. So, like, getting the word out, not only to remember the flu, but then what do you do about the flu? Because, what is the flu? Well, you got to define the flu. All right, the flu is an illness with a fever of 101.5 and all these other symptoms, and then vaccinating helps, but doesn't prevent the flu 100% of the time. So it's a different kind of strategy than with other vaccines. And then if you get the flu, well, actually there's treatment options available. And talking to your clinic or your doctor so that you can be aware that, so for example, Xofluza is a one-time single-dose antiviral, so it's not an antibiotic, and it can be given to reduce the symptoms of the flu.
What's the difference between the flu and a cold?
So a cold is kind of like the common expression for an upper respiratory tract infection, and there are hundreds, if not thousands, of viruses that can cause a cold. And a cold is a nuisance and is usually not an illness that is very serious and, stuffy head, runny nose, sick for a couple days. Flu is that fever, 101.5, and it hits you like a freight train. And so patients, when they get the flu, they know they have the flu, like they're sick suddenly.
Mm-hmm. So the flu comes on, boom, a cold kind of makes its appearance known gradually.
Yeah, and I mean, and a cold can basically, in the healthy person, can just be a nuisance. Like, I got a little stuffy nose, maybe I'm snoring, maybe I got to go blow my nose or something, but it's not like the flu.
Mm-hmm. As a matter of fact, I woke up this morning with a stuffy nose, a scratchy throat, and I sneezed, which normally doesn't happen when I'm waking up. So do I have a cold, or do I have...
Well, there you go. Like, what do you have? And so I think that question is a great question because, it's like, all right, here we are, we're over the radio, we're kind of discussing it. It sounds like a cold, et cetera, et cetera. I think in the next decade or so, we'll actually have diagnostics where we'll be able to say exactly what you have. And it'll be more specific than just cold. So coming back to that, what do you do about the flu? Well, the funny thing is your clinic can diagnose you if you have the flu. And that's important.
Right. So then protecting oneself from the flu, how does one do that aside from a flu shot?
So the flu shot is one step. The other step is to kind of pay attention and see what's going on in your community. One of the ways that our healthcare will be sort of monitored is the public health authorities will see, all right, what's going on in the schools? And if the schools are starting to have a lot of absenteeism, we know that that's most likely the flu. And so if the flu is happening, well, remember that protecting yourself is common sense, hygiene, wash your hands, and then avoiding somebody who is obviously sick.
And hopefully that person knows well enough to stay home. So
exactly. We all have things to do. We all have to go to work. We all have to go to school. But we all do get sick sometimes, so we need to build in a sick day so that we can stay home, and that way the flu stops with you.
Right. Once we get the flu, then, now you talked a little bit about the treatment options. Let's talk a little bit more. What is there out there? Is there a single treatment option, or are there multiple ones?
There are actually several choices, and the treatment of the flu has been a sort of 30-year process. There were some drugs that were discovered way back when, called the amantadines, that we don't really use anymore because they rapidly lost their potency, and most flu strains in the country are resistant to them. And so then we came out with additional antivirals that are referred to as the neuraminidase inhibitors. And now we have this new drug, which is the only single-dose oral treatment for flu, called Xofluza.
There's also now, to add one more element to this, there's this virus going around, the coronavirus. Is this something that is, and it seems like the symptoms of that sound remarkably similar to a cold or the flu.
So viral syndrome is just that, and a lot of viruses can have similar symptoms. And so we need that revolution in diagnostics where we can say, yes, you definitely have this virus.
Right.
As far as the new virus, the emerging virus, the coronavirus, it's concerning because we're still trying to learn about it. And when we're in that phase of we don't know exactly everything about this infection, then people are appropriately concerned. I mean, there was a case that was confirmed in Western Washington.
Right.
And
we understand, and by the way, that person we understand has gone home from the hospital now as we do this. So.
And they actually put that was actually in the media report. So, so I don't know the patient. I had nothing to do with the care of that patient.
Right.
I read the case report in the New England Journal, and I also read the Seattle Times. But yeah, it's like all they're public.
Yeah, right. So then, now I guess people are going to be asking, well, do I have a cold, do I have the flu, or do I have the coronavirus? So
when a new infection comes up, the first thing that will be done by health authorities like the CDC and the WHO is they will do a case definition. So with the coronavirus, the case definition right now is temperature greater than 101 and coming from Hubei province or Wuhan. So that's their questionnaire. And so if you actually go to the CDC website, they'll actually have it. Similarly, you can go to the CDC website and you can get every bit of information you want about influenza.
Right.
And so we're still trying to figure this new one out for sure.
Sure. Let's go back to the flu here in this survey. What surprised you about this Genentech flu survey? Anything that caught your eye that you didn't expect?
It was a good survey in the sense that it kind of validated a lot of what we heard when we were in the clinic or, talking to patients and their families. So that's like that 1 in 4 don't think flu is serious. That struck me because I think that was self-evident and remarkable. So that when I've taken care of patients with the flu and then I'm talking to family members and like, oh, your loved one has a serious medical condition, like they're on dialysis or they got a kidney transplant or something, and all the healthy people in the family didn't get a flu shot. So, you need to get a flu shot. The healthy people need the flu shot so they can protect the sick person.
Right.
And so, I'm frequently getting the word out just in the trenches, if you will, when I'm in the clinic.
Right. And then this other one that caught my eye was when the 80% of people, or almost 80% of people, say that when they're sick, they just try and power through it and not just keep on keeping on, which instead of taking some time out to rest.
And that is then you sit there and wonder, gosh, is that a consequence of our, hyper society, we're on 24/7, et cetera. Physicians in the hospital will struggle with this because patients then sometimes will try and tough whatever they have out, and then it turns out they're a whole lot sicker, and then we have a delay in diagnosis.
Right. What's the takeaway here when when people are all done looking at this survey? What do you want them thinking? What should we be thinking now?
What we need to remember is that universally infectious diseases want you to be ignorant and not know that they're there. So knowledge is power. And so if you have knowledge, so in this case with the flu, you have knowledge that, it's never too late to vaccinate. Number 2, that there's treatment options available if you have the flu, and that the treatment options reduce your symptom burden, meaning that you can get healthier faster if you take something like single doses of Fluza.
There we go. All right. And now where do people get knowledge? Where do they go?
If you need more additional knowledge about the Xofluza, you can go to Xofluza.com to learn about the drug as well as its side effects. And then I always encourage people to go to the CDC website to learn more about influenza and how it affects your area.
How do you spell Xofluza?
That's a good question. Xofluza.
Xofluza. All right. .com?
Yes, sir.
There we go. All right. Dr. Cedric Spock, I thank you for joining us. Take care down in Dallas. Hopefully you don't get the flu. So
there you go. Thank you so much, Ken. Best of luck to you guys.
Dr. Cedric Spock, physician specializing in infectious disease, based in Dallas, affiliated with multiple hospitals in the area, including Baylor Scott and White Baylor University Medical Center, also Texas Health Presbyterian Hospital, along with White All Saints Medical Center in Fort Worth. And he is also a member of the Infectious Diseases Society of America. Didn't know there was such a thing. And that will do it for the 29th edition of Conversation Collage, a shortened one. Apologies for my voice. Next time, hopefully, we'll be in better health and finer fettle, so we can do a little more with you. Reminder to go to our Instagram and Facebook pages, like those, and also rate and review this episode if you're able to do so on the podcast platform on which you are listening to this. Catch us next time for another edition of Conversation Collage. Ken Joannesen here. Be good to yourself. Stay healthy.